It's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered the first question from one of my clients, Andrea. And the question in last week's episode was, my 34-year-old sister is in intensive care with cancer and she had a stroke. She's not waking up. Help. You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Andrea, who has her 34-year-old sister in intensive care with non-Hodgkins lymphoma and a stroke. Andrea's sister is currently ventilated and in an induced coma after a stroke, which might have been a result of complications from cancer treatment for non-Hodgkins lymphoma, such as radiotherapy and chemotherapy. There has been a delay of 3 days after the strokes since she had a CT scan of the brain, which is a big concern because it delayed the diagnosis. So in today's episode of Your Questions Answered, Andrea wants to know if her sister can survive. So today's questions and excerpt from the one-on-one consulting and advocacy session with me is 3 days a long time not waking up after an induced coma with a stroke in intensive care? So you can check out the consulting and advocacy session just by scrolling down below this video, where the dialogue between Andrea and myself has been transcribed. And if you are watching this on YouTube, just click on the link below this video and it'll get you to our website where you can read the consulting and advocacy session with Andrea and myself. You can also look out in next week's episode of Your Questions Answered what other questions Andrea has regarding her sister being critically ill in intensive care with non-Hodgkins lymphoma and stroke. It'll come out in a few days. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you again for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the top of the website. Also, have a look at our ebook section, where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the consulting tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I will see you again next week in another update.